గైస్ హెల్త్ కేర్ డొమైన్ పైన బిజినెస్ అనలిస్ట్ రోల్కి చాలా డిమాండ్ అండ్ ఓపెనింగ్స్ ఉన్నాయి మార్కెట్లో. 10 ఓపెనింగ్స్ బిజినెస్ అనలిస్ట్ ఉంటే అందులో 4 కనీసం బిజినెస్ అనలిస్ట్ విత్ హెల్త్ కేర్ అడుగుతున్నారు. సో న్యూ బ్యాచ్ అనేది వెరీ సూన్ స్టార్ట్ అవుతుంది హెల్త్ కేర్ బిజినెస్ అనలిస్ట్. ప్లీజ్ కాంటాక్ట్ దిస్ నెంబర్.
Okay. So, guys, yeah, this is claim form, but actually, instead of calling claim form, we call it as CMS 1500 form. Please make a note, okay? So, claim form, CMS 15 form, both are same, they both interchangeably used, but formally we call it as CMS 1500 form. So, I'm just taken an instance that Sumant was got treated by the provider. Let's assume that he was diagnosed with some asthma and he got treated with one of the provider, and the provider need to get the money, right? Because he got treated the Suman. So he need to get money. So now this provider team, the provider will have a team, representatives, like air callers, all these people will be there, representatives of the provider. The provider team now will be updating all the details. For example, since Sumant was got treated, so they will update details, all this. And this form now will be sent to the payer, okay, through electronically. So from one system to provider team system to payer system. When they send, so if you see Medicare, Medicaid, Tricare, Champa, Group Health Insurance, and other. So I will say two scenarios here. So you all know very well Medicare, Medicaid is a government insurance in the USA, government insurance. And all these are, we will be having two types of insurance. One is government insurance, another one is private insurance. Government insurance includes Medicare and Medicaid. And private insurance includes, there are many, but out of those, USA popular insurance was Aetna, Cigna, Blue Cross. These three are the topmost insurance in the USA. So let's assume that Sumant was uh, Sumant was approached one hospital, private hospital, let's assume, and he has Medicare. That means he has a Medicare. That means government insurance. And let's assume that Uday has private. Both are visited same private hospitals, but with a different insurance plan. So now let's assume Uday got private insurance. Uday has private insurance, and Sumant has government insurance. So you were approached one private hospital, and now they will check your insurance, the card which you are holding, and as per that they will proceed. So, for example, if Sumant is holding Medicare, all these things, they will check Medicare. So suppose if the patient who has the insurance plans as private, so private we usually select this group, okay, group health plan. So most of the private insurance will falls under this one. So if it is a government, either Medicare or Medicare, only we three use, okay. So let's assume that uh, Uday is holding some ABC Cigna insurance plan. Okay, so the provider team will select this. Okay, and after that here they will enter the insurance. Sorry, the payer details. So for example, ABC insurance. Okay, and the details where they are located. Something. Okay, they just give you about, they just update about the payer details, guys. Payer details. Okay. Okay, fine. And the provider team will be updating whether it is private or government. So in our case, we are going with private. That means group health plan will falls under private. Okay. Now insurance ID number. So insurance ID number, patient's first name. So patient's first name, let's assume Uday. Okay. Patient's address. So patient's address are like let's assume. Okay, I'm just adding city. Uh, USA. Patient city, okay. Okay, patient birth date. So month, okay, let's assume month here. Let's assume, okay. And patient is male or female. I'll select a male. Uh, city, city, let's say, yeah, telephone, the name or contact number of the patient. Okay, zip code, I'm adding some state, Zip code 283992. Okay, patient relationship with the insured. For example, this is kind of nominee. Okay, so if you are going with self or spouse or children or other, you need to select. For example, I'm selecting self. Okay, so insurance ID, insurance name will be you only because we have selected self, right? So if you are selecting your spouse or children, their names will be added in the insurance. Okay, so insurance address I mentioned as okay, state on the toll. Okay, other insurance name, other insurance policy, group number, what else? Okay, okay. Are you able to see 10A, 10B, 10C, 10D? So we usually call it in the CMS form this what is 1A. See what is 1A? It's insurance ID number. What is 4? What is 7? So 11A. So 11B, 11C, we call in this way, okay, usually. So we'll go with the 10A. So let's assume that why this page, oh, for what patient was affected with. So if the patient is currently employment current or previous. So if the patient is has diagnosed with related to uh, suffering from employment status. For example, employee was having some back pain after working so long hours. So in that situation, we select yes. If it is employment related, we select yes. If it is no, then it's ignored. Okay. And 10B was auto accident. For example, if you're met with an accident, so if you're trying to claim the money, so you mention yes if it is accident. Okay, if it is other accident, you will mention yes. So 10D was claim code designated by NUCC. So these are like special status to update. For example, if you have any sensitive information to be displayed other than this employment auto accident or the other accident, if you have any other, so you can update here in 10D. Okay, 10A means employment when you're working. If you are affected with any health condition, that is a option. 10A, 10B means auto accident means unfortunate. Other accident, 10D means it's separate if you have any special uh, what you can say special thing if you want to display your if you want to convey, if you met with any other sensitive information, so you will be updating here. Okay, and okay, this is since we didn't added the insurance insured as a self, so I'm not updating here. So for example, if you added your spouse details, insured their group policy number, your for example spouse. Let's assume that your wife if she's holding policy group and date of birth, all this we will be add. Since I have selected self, I'm not adding anything. Okay, here I selected like I said. Let's assume that Sumant was affected with the back pain due to working for long hours. So I have selected this. Okay. So he actually have a problem of this. Okay. That's the reason he was approached provider to get treated on this. Okay. Okay. If this is a 11. Okay. 11A is your insurer, your spouse or the date of birth. 11B is claim ID. 11C is insurance plan name. So if you're having any insurance plan name, you will update here your spouse or your nominee. Is there any other health plan? So other than this, so I said that ABC insurance, right? So if you are holding any other plan, you will select yes. If not, then no. Second insurance, I mean. Okay, so here, patient has to sign. Okay, patient has to sign here, and your insured you need to sign. Okay, so because sometimes they need to take your consent. Okay, so for that you need to give your sign. Okay, date file. Okay, this is 13 and 12. Okay, this is basically you need to give a consent so that they will proceed with the further procedure. So yeah. Okay, so date of current illness 14. Date of current illness, injury or pregnancy. For example, if Uday was sorry, oh yeah, Uday. Yeah, Uday was fell sick or diagnosed on so and so month. Let's assume 12th month, date 28, and year let's assume 2025. So he fell sick or he fell problematic with health condition on so and so date when it was started, and other date. So other date is like nothing but your uh, any specific date that you're also encounter the same condition of health. So you'll update that details. So month. Okay. Then okay. Then 14, 15, 15 is completed. 16 date patient unable to work in current occupation. So the date, on which date that you felt that you are not able to work due to heavy pain, Uday. So in which date you have experiencing that problem, you need to update in 16th one. Let's assume that you were experience a severe pain on so and so date. Okay. 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 Name of the provider, name of a referring provider or other source. For example, I told you referring means here you approach one provider and the provider is not specialized anymore. And what he does is, since he is not specialized or expertise, he will be referring to other provider, because so that that provider is specialized and he can able to uh, deal this the problem that Uday is facing. So in that case they will update in 17. Okay, 17. So I'm not writing, the provider name will be the specialized provider. They kind of referring, one provider is referring, another provider is nothing but 17th one. Okay, the NPI number, the provider NPI number we will update here. Hospitalization dates relates to current services, hospitalization, and okay, outside lab, the 21 outside lab. So for example, if you are got serviced with any other lab outside, okay, you went for testing, okay, you went for some blood test or some other test. So you will be kind of I mean, if you are out, if you are done out, if you taken the service in the outside, so we will update as 20. Okay, yes. So for example, if uh, Uday was taken the text in some other lab. Okay, so we will update as 20. Okay, so resubmission code means, for example, if the 22 part, 22 resubmission means, for example, if the claim was rejected and they will be updating the new code. Okay, again they will be resharing. So that is called resubmission code. And 22 means here how much amount it was took you for to complete the service for Uday. How much they were charging for this uh, kind of condition to cure by the provider. They will update here. Let's assume $12,000 something. Okay. Prior authorization number. So prior authorization number means, did you remember, guys? Prior authorization means, anyone remember prior authorization means?
Like the insurance approval needed before the treatment, I guess.
Correct. Yes. So there will be a number. So they will update the number here. Okay. And okay, these are the dates. Okay. Uh, 24A, 24B, 24C, 24D, 24E, 24F, 24G, 24G, HIJ. So this is basically 24. Okay. Okay. 24A is basically when the date service was done. Example, when they actually started your service. So there you'll update the date. Okay. Not you. The provider team will be updating the date over here. 24A. 24B is where, from which place of services. I mean, the provider's office will be there, right? The location. So from there, we need to, they will update the location. Okay. 24C is it emergency or not? If it is yes, we will update as Y, and if it is no, we'll update as no. That's it. And 24D what? So I told you, right? So for example, Uday was met with the some employment related condition, back pain. So what services we done, procedure, what service we are done. So we will be updating there. Okay. So all this will be in the numbers. Okay. So we won't write it as office visit. There will be a number. Okay. There will be a number there where they will update. Okay. And why? So why I told you, right? So if patient has any condition, we will update the status over there. 24E and 24F. How much charge they are we are the providers are charging. So we already updated. 24G, how many? I mean, in terms of unit of services, we will update. So how many times like units of services we will be the patient has been providing to the providers, we will update that number. Okay, units. And 24H Medicaid child. Uh, so this is only applicable for the Medicaid child. Okay, 24H. So Medicaid means, right? It's a government body. So is it related to Medicaid? I mean the government. The employee of a government insurance plan or not? Is it falls under insurance plan, government insurance plans or not? We'll update in 24H. And 24I ID type. So provider ID will be update. We need to update. Provider has every unique ID, so we'll update their ID. Okay. And 24J, who treated? Ultimately, who got treated? So I told you, right? Sometimes your referrals will be provided to so and so provider. So who treated at last? All this will update the number. Okay. So yeah, so here one by one we'll update. Okay. So from place of services, office, or is it emergency? Place of services, is it provider office or what? Procedure services code. Are you remember, guys, this ICT CPT codes? So we will update here CPT HTCS codes and charging, how much charges they are used, and days or units, how many days they were being on that provider. Oh, sorry, hospital, and all this. Okay, NPI number and provider rendering provider ID. If someone is treated, uh, some other provider was treated to Uday, let's assume. So their NPI provider number will be there, provider ID. Okay, and the total amount, total charge. Uh, Accept assignment for government claims feedback. Total charge, how much they are charging, and amount paid. Uh, yeah, this is how exactly we all see in the CMS 1500 form. Okay, all this the people used to update, but you need to have a thorough knowledge on this, how it works, CMS 1500, and what kind of the information it contains. Okay, so all you need to update, all they will be updating. You need to have a knowledge. Okay, so prior authorization, resubmission code.
So this will be uploaded by whom? Who will fill all this form?
This is done by the provider. The air callers will be there, right? So
Okay,
the
okay. They are
provider,
the
not we. We need to have a knowledge. CMS,
okay.
how it works. If suppose if there is any changes or if any related requirements are coming from this, we need to definitely need to contribute better, right? So in order to contribute better, we need to understand what is this CMS 1500. So that was the reason I was educating you. We are not going to update, okay? We are not going to update. We are not going to do anything. We need to understand what is 24A, okay? What is 24B? What is 24C? What is 17? Name of referring provider. What is this 13? What is this insurer? What is this patient condition related to 10A, 10B, 10C, 10D? And what is this 26 patient's account number? Okay, what is this 28 total charge amount paid? So all these place of services where it was done and date of services when it was started and till when. All this, so one by one we will update here. Not we, but the provider team will be updating here. Okay, you need to understand. So just go through with the file and do some enter some inputs in the CMS 1500. You'll get an idea. So yeah, provider number, hospital dates, all this I have documentation. You just go and practice so that you'll come to know. Okay. So yeah, so this is CMS 1500. Also call it as claim form. Okay, this will be sent to in the form of EDI from provider side to payer. This code now when we are sending this, we call it as 837 EDI 837. Okay. Where is that? Okay. Yeah, EDI 837 claim submission. Basically, we are these people are submitting claim submission, right? So EDI 837. Okay, and EDI 835 means payment. For example, now they will validate this claim submission, they'll process the payment. So that is called payment. So 835 now. Okay, and 276 EDI 276 is claim status request. So for example, the provider team was requesting regarding the claim to the payer, and they will be sending a text file, and they'll update some data, and from their system to payer system they'll send. So when they are looking for to know the claim status, we call that as 276 EDI 276. And when we get a response from the when we get a provider when we get a payer response, we call it as 277. So these are mostly we use, I mean, in the interview, and these are the main expectation codes of EDI. So yeah, so from provider, system, and payer, they will be communicating. Okay, they will be interchanging the data. Okay, interchanging the data. Okay, healthcare data. So to know the status, communicating purpose, they will follow these codes.